This morning in today's checklist, we are talking about 3 viruses that tend to surge this time of year: flu, COVID, and RSV. And of course, they can all cause serious illnesses, especially in vulnerable groups. So we have NBC News medical reporter, Dr. Akshay Syal, here to help us stay protected. Good morning to you, doctor.
Good morning.
All right, so let's start with the big 3 and the differences between flu, COVID, and RSV. I think it sounds simple enough when we're standing here, but when you're home and you don't feel good and you're just not sure, let's talk about how you can tell.
It's a lot to think about, right? And a lot of people have heard that phrase triple-demic from a few years ago, and these are kind of the 3 viruses we're talking about. And so, Chanel, ultimately the best way to tell the difference is a test, right? Okay. There's no substitute for a test, but we have some symptoms here that I think can kind of help people differentiate between. And so, when we think flu, think freight train, right? One minute you're feeling fine, the next minute you're 3 seasons deep in Love Island on the couch, right? You sort of get a little sick pretty quickly. With COVID, the symptoms can vary. The onset can vary. You can have, stomach upset, we tend to see because we know the virus can get into our bodies. And with RSV, the big thing to keep in mind, respiratory syncytial virus, the big thing to keep in mind is wheezing, right? We worry about the virus can get a little bit sticky. We worry about it causing lung problems, especially in young and older adults. So here's the good news, right? There are rapid tests available that can tell the difference between flu and COVID. You can buy this over the counter. And none of my patients know this. I would love for all of them to watch this segment. I've
known they have the COVID test, but I didn't know you could test for it. Did you guys know that flu?
Did not.
And that's why we do this, right? If you test for the flu versus COVID, there are treatments, so it's important you know which one. And then finally, virus versus bacteria. A lot of people come to me, they say, Doc, I have the flu, I need a Z-Pack. No, there's no antibiotics.
We all want it.
We all want the Z-Pack. Trust me, you should see my messages.
Really quickly, who's most at risk? Should we talk about that?
Who's most at risk? Anyone who's essentially got a weak immune system, right? People over the age of 65, those who are pregnant women, and those with chronic disease, right? People with asthma, heart disease, or lung disease. Any sort of condition that can weaken that immune system is when we call high risk. And it's really important if you are any of these people here and you have any sort of sickness, you call your doctor because we can prescribe treatment for some of those viruses.
And don't let it linger, take care of it.
Yeah, exactly.
Well, to that end, though, Doc, how can you tell when to maybe try to weed out the illness versus when you should pick up the phone and call your doctor?
Right. When do you sit at home versus when do you call me, right? Red flag symptoms, as we say, Craig. And so we have some here. Difficulty breathing is, I think, the most important. If you're at home and you can't catch your breath, you're winded, you're out of breath, call your doctor immediately or call 911. If you're having chest pain, severe weakness, severe cough. And what do I mean by that, right? If you were coughing up green phlegm, if you have a high fever, that won't go away. And here's the big one that I think most people don't know. Ready? If you start to get better and then you get worse, call us immediately because you could have a bacterial infection at that point.
Oh, wow. Good. Did not know that. Yeah. My friend Dylan has a few questions.
So how can we prevent getting anything to begin with? How do we stay safe?
So now is the best time, right? October, we're it's sort of the about to hit flu season, right? And so flu before boo. Have you heard that before?
I haven't, but I like it.
It's actually a saying endorsed by the American Academy of Pediatrics. It's get your flu shot before Halloween. I say go do it when you're getting your Halloween costume. Flu mist. There is now an at-home flu vaccine. It's through the nose for people who don't like needles.
Is that okay for kids too?
It's for ages 2 to 49. And you can order it right to your door. And then flu and COVID, it is absolutely okay to get the vaccines at the same time. And RSV, if you are over the age of 75, even as young as 60, we can do if you have those high-risk conditions we mentioned.
Okay, what about ways at home to just, ward off any kind of illness?
Ward off the bad juju, right. Keep those hands washed, right? It's very, very important. It does actually get rid of the virus. Stay home when you are sick. I know we say this all the time. Stay home when you are sick. Wear a mask if you are sick. Wear a mask if you are high risk and you are traveling. Improve ventilation. We don't talk about this enough, but get an air purifier at home. Make sure you're sort of filtering the air at your house and seek early treatment, especially if you're in those high risk people we talked about. We can prescribe treatment, and the earlier we start it, guys, the better.
Learned a lot
but
here.
Stay home when you're sick advice. There's some folks here.
Well, because you try to suck it up.
They come and
you don't know how sick you are.
I think he's calling one of you out.
No, not this two. They're usually
I
pretty
should
good.
go home right now. Thank you, Dr. Syal. Thank you for coming.
Because I'm making you sick.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.